Okay, so now we're going to go ahead and start our wound dressing change using sterile technique. Okay, so of course you want to go ahead and perform your hand hygiene. At this point, your pain medicine should have been administered and patient is comfortable reporting no pain at this present time. So now I'm going to go ahead and open my dressing tray here. Okay, remember we use the same technique that we use for our Foley and opening any other sterile supplies. Okay, so your kit will come like this. Remember, away from you, side, side, and then opening up towards you last. Okay, remember, any edges hanging off, we will just leave them there. Okay, you have plenty of room to work with. Remember your 2-inch border. Okay, so now at this point my sterile gloves are on top, but I do not use the ones out of the kit, so I'm going to go ahead and put on my extra pair of sterile gloves that I have, and you all should be familiar with how to open to don your sterile gloves. Okay, so I'm going to lay those there. Now we are doing a wet to dry dressing, and so therefore, since I am doing this on my own, I will go ahead and set up my tray, and then I will pour my sterile saline, which is what is in the order, in our patient's wound dressing order, as to what we will use to soak our gauze before packing. Okay, so I'm going to first go ahead and don my sterile gloves. Again, putting on my right glove first, since this is my dominant hand. And then dress my non-dominant hand. Okay, remember that thumb is out, and that's it. You can leave your paper here. If you have not touched the inside of your paper, you can grab it in the center and just toss it off. Okay, remember, we cannot drop our hands below our waist or raise our hands above our shoulders. Okay, so I'm not going to use the sterile gloves that come in the pack, so I'm just toss those over there, get them out my way. Now I have a sterile drape here that I do want to use to extend my sterile field. So if I'm going to extend my sterile field, then I need to keep this drape sterile. Okay, so it doesn't matter where you choose to place your sterile drape. Remember, keep it up in the air, shiny side down, and don't allow it to drag or touch anything. Drop it and then use the center to fix it like you want. Now in your kit, you have this red bag here. This is what we call a biohazard bag. So again, when you're opening your sterile supplies, remember, keep them up in the air. Don't let them drag across any surfaces. I'm going to go ahead and set this up, okay? And I'm going to place this to the side over here. So if I have any dirty gauze or anything like that that I need to put in there, I can, okay? So I have that situated. Now, once you put any dirty supplies in that bag, the inside of that bag will no longer be sterile. So just remember that. Now, I have my iodine swabs here, betadine swabs. We're not doing any cleaning for this checkoff. Our order just states we're just going to change our dressing. So I do not need these swabs. And then I'm going to look at what dressings I do have in this kit. Now the order says that I'm going to do a wet to dry dressing with Curl-X soaked in sterile saline 0.9% sodium chloride. Then 4x4s, dry 4x4s, and then ABD pad, okay, which is my top drape for top dressing for reinforcement, okay. This is my Curl-X. This is what you call this particular gauze. It's nice and soft. I'm gonna sit this here. I don't need it right now. And then these are my 4x4s that I will use along with my ABD as part of my dressing as well. So I'm gonna go ahead and set that up there. I have some sterile Q-tips. I have scissors, and I have forceps, okay? And I also have some tape that is sterile. So I'm gonna sit that there. Now, I have, if I wanted to at this point, before I break sterility to pour my saline, I'm gonna go ahead and cut my Curl-X or my gauze, because the order says saline soaked Curl-X gauze is what you're going to use to pack the wound, not the 4x4s. And when you open your kit, you will see that the Curl-X is much softer than the 4x4s, which is better for packing the wound bed. Now, as you see, this comes in a long roll, so I'm going to make it easier on myself for packing purposes. I'm going to go ahead and cut my dressing, okay? So when I'm cutting my dressing, I'm going to cut and prepare my dressing over here. Never cut your dressing over the wound, because when you cut this dressing, and you'll see once you start to work with it, there's little shards of the gauze or so forth that will come off. And if that gets into the wound bed, it will possibly prevent healing in that area, will cause irritation, almost like a splinter, okay, in your finger. So I'm going to go ahead and I'm going to cut my gauze. And as you see here, I'm not making them too small, but I'm also not making them too long. I want them big enough to, you know, provide enough packing to cover the wound bed, but I also don't want to make them too long, because if I do, it's going to make it more difficult to pack your wound without contaminating your gauze, and you'll see what I mean in a minute. So again, just nice little 4x4 gauze, okay, as far as the shape. All right, so for right now, I'm cutting my gauze and I'm eyeballing my wound just to see about how many of these I need. If I keep both hands sterile during this procedure, which is best practice, then if I find that I need more gauze, I will be able to come back and cut more because I've kept both hands sterile, okay? So I think I have enough there. If not, I can always come back to it. So now I am ready to pour my saline. So of course, I'm going to have to break sterility because I am alone. So go ahead and take these off. Now, again, anything you pour onto a field, you want to verify what it is. So I have 0.9% sodium chloride, and expiration date May 1st, 2026. So I am a good to go ahead and pour this. All right, so I'm going to uncap my liquid here, set my top there. And remember, when we pour, we do it intentionally with purpose so that we prevent splashing, but also no dripping of the solution on the sides of the bottle. So where I have my cut gauze, I'm gonna go ahead and pour some of my saline, okay? And as you see, that nice purposeful, clean pour and step back, okay? Not leaning over your sterile field with this to prevent contamination. Just standing back, nice purposeful pour. You don't need too much. The gauze are not meant to be soaked, dripping water, but just enough to dampen them, okay? Remember, you follow your facility policy on recapping and reuse of sterile fluids, okay? So I'm going to sit that over there, all right? So now, I have my liquids poured, but I can't touch anything, right? Because I'm not sterile. So at this point, I'm going to go ahead and put on my sterile gloves. Remember, it is best practice, especially if you are not capable of donning your sterile gloves on the same surface area as your sterile field, just use another surface area or table, okay? So I'm just gonna come over here, and actually I got enough of an area over here to don my sterile gloves again without contaminating my sterile field. So I'll put those on. Step away, remember, step away so you don't accidentally touch your gloves against anything. Dominant hand first, and non-dominant. I'm gonna go ahead and toss that. 4 fingers under the cuff, thumb is out. Open the glove up. And let go. Okay, so now I'm ready to go ahead and prepare to do my dressing change. So you at this point, you're sterile, so you can touch these gauze. You don't have to be afraid to touch them or handle them. So as you see, I'm just getting rid of squeezing out some of that extra sterile saline, okay? If the order was sterile water, we would use sterile water, okay? Because again, I want them to be damped, but not soaked, okay? So now when we're getting ready to pack our wound, there's a couple of things you want to remember. So now I have some Q-tips here, and I have some forceps, which either one you choose to use is up to you. Whatever is helpful and makes you feel more comfortable is fine during checkoffs, okay? One thing you do want to remember, whichever side that I use, so if I use the Q-tip side, if I'm using my tweezers, if I use, my forceps, if I'm using the forceps side or the blunt side of the forceps, I have to continue using it in that fashion. And what I mean by that is I cannot use this end to pack the dressing into the wound and then turn around and flip it in my hand, because now this hand is contaminated, okay? Because that wound, even if we clean it, it is still dirty. Remember, some of these wounds the patient may have MRSA. So whatever side I use to pack the gauze into the wound, I remember that's the dirty side. Just think of just like with the Foley, when we're cleaning the meatus, we're cleaning with our sterile hand, but we're using the end of the Q-tip, making sure not to touch it, okay? So let me demonstrate what I mean. I'm getting ready to pack. What you want to remember is that any undermining that I have at 12, the tunneling that I have at 8 o'clock, I want to pack those first. The reason being, I want to fill this wound bed up with gauze. And the purpose is to use that gauze to draw in any moisture or drainage inside of the wound bed, okay? Because anytime there's a lot of drainage, a lot of moisture, it's warm, it is a breeding ground for bacteria and infection. So that is the whole purpose of these gauze. So if I fill the wound bed, the wound cavity itself with gauze, but did not fill the undermining or the tunneling with gauze, then those areas would continue to have drainage, and that would sit there creating that moisture, and thus that undermining and tunneling would continue, okay? So I want to go ahead, the whole purpose is to fill this wound cavity completely, okay? From the wound bed to the edges of the wound to collect that drainage, okay? So I'm going to go ahead and start packing. Now, whichever way is comfortable for you is fine. The goal here is that when we are packing, this gauze should not touch the patient's skin. If it touches the patient's skin, you would simply state the gauze touched the skin and I'm going to discard of it, okay? The reason for that is even if we cleaned our wound, okay, and we cleaned the area around the wound, okay, it is still the skin. It still has bacteria, okay? And if we allow the gauze to touch the skin and then pack it into the wound, we're now introducing more bacteria and contamination to the wound, okay? Remember, this wound is not sterile, okay? But handling the supplies that we insert into this wound will be sterile, just so we are trying to prevent from introducing any more bacteria or pathogens to the wound that will delay wound healing. Okay, so however you choose to do this is fine. What we don't want to see is you just dropping the gauze in the wound and then pushing it in, because eventually you're going to end up touching the skin with this gauze and bringing that into the wound. So as you see, I'm keeping my gauze protected in my hand, and I'm just letting a little bit of the gauze loose and free so I can direct packing it into the wound. So we're going to start with undermining first. So you see, I'm using the Q-tip to advance the dressing into the wound bed, okay? And this will happen, it will stick, okay? And then I'm gonna drop it, okay? So I'm just gonna leave it like this, and then I can pack it down later, okay? What you don't wanna do is use your fingers to pack a wound. Again, these wounds are dirty. Some have MRSA present, and you do not want, that is not good technique to use your hands, okay? Plus, you want to try to keep your hands sterile, both hands, in case you need to cut more gauze. Now, I'm going to get another piece, and I'm going to proceed to pack the wound, okay? I'm being very careful not to allow my gloved hand to touch the inside of the wound. And you're more than welcome to use 2 Q-tips, whatever you need to sort of gauge or help you in advancing the gauze into the wound, okay? Now, if I'm going to put a Q-tip down, remember the tips are dirty, they're contaminated. but I wouldn't put it over here on a totally contaminated surface, because if I do, then the whole Q-tip is contaminated. So this little extended sterile field that I made here, I'm going to put my Q-tip there. So as long as I pick my Q-tip or forceps back up on the end that I have kept sterile, this is fine, okay? The only thing that's going to be on this area, this extended sterile field, are whatever tools I'm using to pack, okay? So I'm going to continue to pack, get that undermining full of gauze. Remember, if you accidentally touch the skin, it's okay. Just verbalize that and remove that gauze. Okay, so now I'm going to move to my tunneling. Okay. And I'm going to get that nice and packed. Drop, okay. Now, once I have packed nicely my undermining and my tunneling, now I can pack the wound bed itself to fill it with the gauze for collection of drainage, okay? Now, you may ask, well, if the Q-tip or the tip of the forceps is contaminated, why are we still using it to pack the wound? Why you wouldn't get a new Q-tip and a new forceps? So we are using this Q-tip that is already touching the inside of this wound, okay? This is the bacteria from that wound. So we can continue to use it, all right? However, if I was to lay it on a contaminated surface, touch another area of the patient's skin, or as this model has multiple wounds, now I cannot use it back in the same wound. And I'll explain more of that in class if you have questions, okay? But it's just like, think of it like you using a spoon, okay? When you're eating, that spoon is going into your mouth. Yes, once it goes into your mouth, it's no longer clean, but that is your bacteria in your mouth. You wouldn't take that spoon and lay it on a countertop and put it back in your mouth, or you wouldn't stick that spoon in someone else's mouth. Now, this is different from the Foley demonstration, and where we're cleaning the meatus and we are only using those swabs once, right? Once, one pass. So for this situation, we're not cleaning the wound with our Q-tips or forceps. We're using it to aid in packing the wound with the dressing, okay? So I hope that explains it. If not, again, we'll discuss more in class. So I'm going to now fill the cavity of the wound. Okay. And I'm just sort of trying to keep control of my gauze. Again, if I drop it and I need to use some reinforcement, I can. Okay, laying that back onto my sterile surface. It dropped, so of course now I have to use one of my forceps. It's fine, just leave it there. Now, say for instance, I'm going to put this dressing on and I do this. You see it's touching the patient's skin. I would just pull it back up, drop it into the bag, that biohazard bag, and then I would go back and cut and prepare another piece of gauze, okay? So basically, the end result is you want your wound bed nice and full. It is harder on these plastic models, but in real patients, because of the tissue and the collapsing of the tissue, you would easily be able to fill this entire cavity, from the edge of from the center of the wound all the way to the edge. Because again, the goal is, if we have it packed with this absorbent gauze, any drainage will be brought into the gauze, keeping the wound bed free of puddling or drainage as much as possible. Okay, so you get the picture. We want that wound bed nice and full, making sure any undermining or tunneling has also been packed to help absorb any excess drainage. Okay, so I'm ready now for my top dressings. Okay, so the order says Curlex soaked in sterile saline. That is what you will use for packing. And then 4x4s, and this is 4x4s, 4 size, 4x4 centimeters or inches on each side. And then our top dressing is our ABD gauze. Okay, remember with this gauze, it's a blue little strip. Don't know if you can see it here. That blue should be up to the sky. As you see, I'm just handling the edges, and I'm just gonna plop it there. Okay, now good technique, you would then take these off. Your sterile portion procedure is over with. Okay, so I'm going to get rid of those gloves, and they were still sterile and clean, but just proper procedure when you're handling the top dressing. Remember that dressing, the patient will be able to touch it. It will be next to their gown, their sheets, their bedding. Providers may come and take a look at the dressing to make sure there's no excess drainage. So we just want to keep that top dressing as clean as possible. No contamination, no blood from our gloves if that was to happen, or any drainage. So took my sterile gloves off, did some hand sanitizing here, and then now I'm going to go ahead and put on some clean gloves. Okay, all right, so once I got these clean gloves on, I'm going to now go ahead and tape my dressing. Okay, so it doesn't have to be perfect. You want to be mindful of how much tape you're using, because again, this tape has to come off, and it's just going to cause irritation for the patient. Okay, so just tape along the edges. Okay, okay, again, don't overdo it with the tape. Okay, be kind to your patient. All you're doing with this is just securing the edges. Okay, okay, as such. All right, so now my wound is nice and dry. Some wound kits will have labels, or what you can do is on a last piece of tape, you can get a piece of tape where you can get a felt tip marker or some type of marker, write on the tape your initials, the date, the time, and then you would lay it on the dressing. Now, you won't see that in clinical practice. You will actually see, after this is completed, they'll take a marker, felt tip marker, and initial it with their initials, the date, and time. But we teach you, we never write on a patient. And so this is best practice, to do your initial, date, and time on either a separate piece of tape, or if the kit comes with a label for your initials, date, and time, you would write that on a on there and then apply it to the dressing. Okay, so that's it. Real easy. you know, but your sterile technique is following you from Foley into sterile wound dressing change. Okay, I hope I've answered all your questions. If not, just write questions down and we can discuss them in lab. So at this point, I would go ahead, take those gloves off, do hand hygiene, put on clean gloves, gather up my trash, any bloody drainage, any sponges with blood or bodily fluids on them would go into that red bag, and then that red bag must go into the facilities contaminated or soiled area into another red bag. The reason is because it has bodily fluids on it. This lets housekeeping know that, hey, be careful, because those bodily fluids could be contaminated, right? So we never take anything that has a patient's bodily fluids on it and put it in the patient's trash, okay, in their room. If you do if you do not at the time have a biohazard bag and you're removing their dressing and you need to discard of those dressings, you can put it in the patient's room trash, but then you want to bag that up and take it out and go and put it in the facility soil utility room in a red biohazard bag. Okay.